sermon today is the cost of sin. And I mean that in a literal sense, the cost of sin. On the sixth day of creation, God created man, and he created us to be perfect. Pronounced it very good. And somewhere along the line, it really went off the rails. With the introduction of sin, we have launched on a steady progression over the years to where we are today. And my background, for the most part, has been in healthcare with critical care and all the things that goes with it. And today we're going to talk about chronic illnesses and the impact that they have on everybody that's in this room, that is in this country, and in this world. And I don't think that people understand the impact that it has on our daily lives. And so we're going to focus on some of that, and then to wrap it up with some things that we can do to change some of the things that we've done. From birth, our body starts to die. Our cells die from the day we're born, if not before. And over the course of our life, we regenerate cells that are reproduced at a greater rate than those that die. But it will reach a point when we start to age and ultimately end up looking like me. Worn out, broken down, spare parts replaced with metal and those kinds of things. A lot of this stuff is self-inflicted. And so today with the focus on chronic illnesses. Chronic illnesses is something that is long-term, generally incurable, but can be managed. And so most of them are preventable. To be that we live in a society where it's a fast food, high fat, high sugar environment. And so I'm going to give you some data points, and of course, every good lecture's got to have data points, right? So, and I took this stuff from CDC, NIH, Diabetes Foundation, Heart, Lung, and Blood Institute from NIH and others. So the data is as accurate as I can make it and as up to date as I can make it. 7 out of 10 deaths, killing more than 1.7 million Americans every year from chronic illnesses. Every 30 seconds, a lower limb is amputated because of diabetes. 81% of all hospital admissions, 91% of all prescriptions filled, and 76% of all physicians' office or visits are from chronic illnesses. Now here's something that the total spending, this was in 2005, total spending on chronic illnesses was calculated in 2005 to be $2 trillion, roughly 10% of GDP. Now, we're only going to cover just a few chronic illnesses, but there are many. In fact, if it wasn't for chronic illnesses, I wouldn't have had a job for 30 years. There's entire disciplines in healthcare that's related to lifestyle situations, for the most part, not 100%, but for the most part. And I was a respiratory therapist, specializing in high-risk deliveries, medical transport, and critical care. And ultimately went on to teach it at a community college, without chronic illnesses, I would not have a job because the discipline would not have existed. Pulmonology, a specialized field of medicine, would not exist in today's world, at least at the level we have it. Emergency medicine is pretty much lifestyle focus. Oncology, endocrinology, cardiology, all of these disciplines are because, for the most part, of the way we live our lives. And so the way we live our lives directly impacts everything from birth to grave. So we're going to start with obesity. And I'm doing this because of all the chronic illnesses, obesity is the one that directly impacts more things than pretty much the others put together. And the data is staggering. And here are just some of the things. It's the most common of all chronic illnesses and conditions, but it's not new. Going all the way back to Socrates, it was determined that it was a disease of the wealthy and affluent. It leads to increased accidents and death, increased the likelihood of cardiovascular disease and stroke, increases the likelihood of type 2 diabetes, hypertension in adults and children, likelihood of life-threatening cardiac dysrhythms, cognitive dysfunction in children. In 2018, roughly 42% of all Americans were considered obese. That did not count those that are overweight, but reaching the threshold. In 2008, the annualized cost of obesity was $147 billion. Medical costs for those with obesity is $1,400 per year above the rest of the people with healthy weight. Childhood obesity is increasing rapidly. In 2018, 14.4 million children and adolescents were obese. Now that does not factor in just the overweight children and adolescents. That's obese. So you factor that, you know, there's probably at least as many that are approaching obesity as actually diagnosed with obesity. So when I taught EKG technology, and one of the things that we did was at the end of the class period, they had to bring in a child to do a pediatric EKG, and the reason they did that is you have a different hookup and different connections. So I want to make sure they could do them right. When I was a child, nobody ever heard of giving a kid an EKG. But today it's routine in a lot of places. And I was stunned by what I found with these kids coming in for pediatric EKGs. Kids as young as 10, 12 years old were having cardiac rhythms you would expect to find in an adult. And I'm not talking about a healthy adult, I'm talking about a 70-year-old smoker, okay? Rhythm changes of life-threatening conditions. Kids as young as 15 dropping dead because of exercising too much and overweight. This is the true cost of what I call the true cost of sin, is what we're doing to our children. Most of my career was spent taking care of kids, by the way. So then the next thing that I want to talk about is obstructive sleep apnea. Now, obstructive sleep apnea is directly related to obesity. And if you have an overweight or obese, you're certainly at risk for obstructive sleep apnea. And obstructive sleep apnea is, again, sleep technology is a relatively new field that was brought in, started somewhere in the early 1980s. I taught sleep technology and found some really interesting things. That people that have obstructive sleep apnea, a much higher rate of cardiac arrhythms and sudden death. And I can't give you the data points because I couldn't find what I was looking for. So I'm just kind of going to wing it. But you have, it impacts the congestive heart failure is related to obstructive sleep apnea, either directly or indirectly. School's still out on that one. But in children, we're finding children that have apnea spells significant and clinically significant in that when you have obstructive patterns at night, your oxygen levels desaturate and your brain and your heart does not get the oxygen that it needs. So when kids are obese, they end up with obstructive sleep apnea, and they shouldn't even be considered for apnea in a kid. They just shouldn't. They're structurally not designed for it. So these kids then desaturate their oxygen levels at night, putting a strain on their heart, and it slows cognitive learning. So obesity in children, it really is an epidemic, and obstructive sleep apnea is certainly one of the side effects. Now, next on the hit parade is diabetes, type 2 diabetes specifically. 2014, roughly 10% of all Americans had diabetes. That's CDC data. A little over 29 million people. That number has not gone down. A full half of the population of the United States either has diabetes or prediabetes. Now, prediabetes is pretty much defined as you have high blood sugar, that you can still correct it before it really turns into something you've got to have to take shots for. But high blood sugar damages all sorts of things. So we see in kids developing type 2 diabetes. And we're seeing just a myriad of problems with this kind of thing. Hypertension. In 2017, new guidelines were published to redefine hypertension. I'm not going to get into the, what's normal, what's not normal. Doesn't really matter for this. But in 2019, 500,000 Americans had hypertension as a primary or contributing cause to their death. 500,000. Healthcare costs in 2014 was $131 billion, directly related to hypertension. Now, hypertension is also people that have a weight problem. Hypertension is certainly a problem because the heart's got to pump against a very restricted blood system. And so the harder it is for your heart to pump, the greater likelihood you're going to have of an enlarged heart. And it will generally manifest on the right side of the heart first because that's a smaller chamber. And in fact, when I was teaching EKGs, the one thing I told my students to look at when they were defining or when they were reading an EKG was to look at the P wave or the small wave before, in that way Yeah, that one. So the P wave tells you about right-sided heart, the atrial problem. So if it was, without getting too complicated, you can determine whether or not you're in danger of cardiac problems by looking at the right side of the heart, because it's going to alter first. But I found that in children in particular, they were having P wave abnormalities as young as 10 years old, which means that they ain't going to live to be my age, okay? So heart and cardiovascular disease, number one killer of Americans, number one. One person every 36 seconds dies from heart or cardiovascular disease. About 795,000 people each year have a stroke. In 2017, the cost to healthcare was about $365 billion for cardiac and cardiovascular disease. Most cardiac disease can be prevented. It's pretty much lifestyle oriented, unless you have a congenital heart disease or something along that. But normally, cardiac disease is a self-inflicted wound. COPD, this was for what I did for many years. In 2018, roughly 15 million people had a diagnosis of COPD. And there was probably at least 15 million more that had COPD that was never diagnosed. COPD, smoking is by far the leading cause for COPD. Now, COPD is broken down into three categories, actually. You have emphysema, which is where the walls of the lung tissue break down. You have chronic bronchitis, where you have the airways fill up with stuff. And then you have asthma, untreated asthma. Generally, you have a combination of the three. But smoking is primarily the cause. Now, the leading cause of COPD, interestingly enough, in people that don't smoke is because they live with a smoker. And because as whoever you're living with breathes out, you're breathing in. So it's inevitable that you're going to get something along smoking-related illnesses. Now, COPD is only one thing. Another is lung cancer, soft tissue cancer, throat cancer, liver cancer, stomach cancer. Choose your poison. All increased risk for smokers and people that live with smokers. Smoking was responsible for about 480,000 deaths per year, or about 1,400 per day. $265 billion in direct medical care, and $156 billion in lost productivity and premature death. There's many other chronic illnesses, but these are the ones that I feel that I have the time to talk about today, all right? Now, to draw this thing all together, what can we do about it? I mean, we've identified the problem. Now, what can we do about it? There are 11 major organ systems in the body. And when you have one that goes bad or is compromised, it's going to impact another one. It's a matter of mathematics. If you have 2 organ systems out of the 11, you ain't really healthy. By the time you reach 3 or 4 organ systems, all you need is a flu to push you over the edge. It's just diminishing returns. That's all it is. Straight mathematics. We live in a society of high fat, high sugar, and very little exercise. And we wander from one fad diet to another, whether it's the Atkins diet or the keto diet or the fast, it doesn't matter. None of them are healthy, okay? And we spend a huge amount of money on these diets. Now, we routinely put things in our bodies that are damaging to toxic and damages others around us. A lifestyle and the foods we eat can actually damage our genetic markers, so we can pass this on to our kids. And it's been shown that, you know, certain foods and certain drugs we take impacts the sperm of males, either in decreased motility, which leads to infertility, which is another booming industry, to diseases and conditions that are passed on because of genetic markers. This causes mutations, and no mutation is ever good. There's never been, since man was created, mutations has never been good. And then there was a good study out of Australia a few years ago that showed that the Atkins style diet, the high fat, low carb diet, with the somewhat misguided idea that you're going to lose weight with little or no change in lifestyle. You do lose weight, but at a great price. And in fact, I've got two good friends that now own an insulin pump because of Atkins diet. It was found that such diets causes changes in heart rhythms, cardiac contractual impairment, sudden death, osteoporosis, kidney damage, increased cancer risk. And that's because you're trying to lose weight with a high-fat, high-protein type of diet. We eat way too many simple carbs, such as sweets, pastries, and so on. And an interesting side effect is that young women that eat the modern diets, the high-fat and high sugar, enter puberty much earlier than do the counterparts in undeveloped countries. Now, as Adventists, we have a health message that goes way back to our earliest days, and you guys could probably teach me about that because I really am new to this. And I'm certainly not a poster child for healthy living by any means. I used to tell my students that Swatzell and stupid kind of hung out in the same area of the dictionary. But I'm forever grateful to God that you can change your lifestyle and your behaviors. Unlike other animals on this earth, we can alter our behavior. And because what we have in this country is we don't have a healthcare system. There's nothing in what we call a healthcare system that has remotely anything to do about health. It's a crisis intervention system. There's no money spent on preventive medicine. There's no money spent on nutrition. And in fact, in 2015, the NIH spent about $11 billion on clinical research and $2 billion on nutrition. Now, the nutrition that they spent, remember, these are the people that says French fries and school lunches is a vegetable. So I wouldn't put a whole lot of stock in anything that come out of that study. But as Adventists, what can we do? Obviously, the school lunch programs that's in schools is horrible. Just they're setting kids up for all sorts of problems. A healthy diet has many benefits. We live longer, look and feel younger, more energy, we lose weight, and so on and so forth. I'm going to run short of time, so I'm kind of going to go through this a little bit here. One thing about when I talk, I have a very hard time telling myself to when to shut up and sit down. But here's something we should minimize or eliminate fast food. For one thing, it ain't food, and another thing, it ain't fast. A Whopper or a Big Mac, fries, and a large drink comes with between 3,000 to 5,000 calories, most of which are fat and salt, sugar. And this stuff's actually addicting. You go by now that we don't go in the restaurants to eat, you go by a Burger King, man, they're parked out in the street waiting to get in, okay? A breakfast sandwich today at one of these places, 500 to 700 calories. That's just a sandwich. I found that kids, when I was teaching, and I evaluated, and when I got looking at these kids in particular on their health styles, that a child of 15, 16 years old routinely eating up to 7,000 to 8,000 calories a day. 2,000 max, even for somebody that's active. So how we can eliminate or minimize all packaged and processed foods. It's primarily salt, sugar, and fat. And it always amazed me that the healthy style life thing, if you want an eye opener, read what's in this stuff. Most of it's sugar and fat and salt. And minimize or eliminate dry cereal. Pretty much shredded wheat is the only healthy dry cereal out there. Wheaties, for instance, the number one ingredient in Wheaties is sugar. Number one. Now, if you look at leafy vegetables, the cardiologist used to say that I work with, that when he was instructing his patients, that if you like pastries and all that good stuff, he said, don't eat that stuff. And if you don't like spinach and green beans and all that stuff, you can eat all that you want. But of course, nobody ever did. But eat your, whole foods, whole vegetables. For instance, in spinach, and this is something that I was amazed at because I didn't know this. At least six macronutrients such as calories, protein, fat, carbohydrates, and fiber. 10 minerals such as calcium, iron, magnesium, zinc, and so on. At least 9 vitamins such as vitamin C, B1, B2, B3, B6, folate, and so on. At least 8 fatty acids. At least 18 amino acids in spinach. We should eat a lot less animal fat, a lot less whole milk and eggs, reduce our calorie. It's a matter of mathematics. If you need 2,000 calories a day to maintain your weight, you eat less than that, you're going to lose weight. You eat more than that, you're going to gain weight. And if you exercise while you're eating those, then you're going to lose weight quicker, and you're in better health doing it. And one thing I will tell you that those of us that are mobility challenged, you can still exercise. There's hand exercises, there's upper body exercises you can do to burn off calories. Eat smaller, more frequent meals. This is something I used to teach to my COPD patients, that you would eat breakfast and then a mid-morning snack. You would eat a light lunch and a mid-afternoon snack and a light supper or dinner, depending upon where you live. And then a bedtime snack to kind of keep the hunger pains away. But as long as you kept some food in your stomach, your brain didn't think you were starving to death, so you didn't gorge. So you have to retrain your brain, essentially, to get along with your body. Because remember, it all starts upstairs. It don't start in your stomach. Drink a glass of water before your meal. You'll eat less. because your stomach will be full, and the sensors that tells your brain that you need food tells your brain that you don't. So drink a glass of water, eat your meal, you'll eat smaller meals. Purchase your fruits and vegetables from local growers if you possibly can. Vegetables and things like that in supermarkets are raised specifically for color, marketability, and transport ease. There's nothing in them that's designed around nutrition. They're picked green for the most part, particularly tomatoes and softer fruits. And then they're run through a gasser or some other ways to turn them red. Oranges are dyed and grapefruit are dyed. And so all of that is designed to please the eye and increase profit margin. Whenever possible, grow your own. Excuse me. By growing your own food, it does a lot of things, but I'll urge caution on that too, because a lot of your seeds, even if it says non-GMO, it does not necessarily follow that they're healthy seeds, okay? Because remember that they're planted in something, somewhere. And just because somebody's not tinkering with the DNA and RNA on the corn plant does not follow that it's not grown in something that's not going to be good for you. And you can't replant these seeds because you don't own those seeds. The big companies that sold you the seeds owns those seeds. And you can actually get in serious trouble replanting seeds. So when I grow tomatoes, which I love to grow tomatoes, I plant heirloom tomatoes. I plant as much heirloom stuff as I possibly can. There are heirloom distributors out there like Barrera College out of Barrera, Kentucky, that use the old seeds, a lot of it open pollinated or whatever. But nevertheless, that's the kind of thing that is at all possible if you can find certified growers that you trust. Can, freeze dry, process your own foods as much as possible. It's healthier. You know what it was grown in, you know who grew it. And so that's probably the best way to start getting back into processing your own food. We don't do that anymore. Most people would know how to can a green bean if they had to. We need to start getting back to that. As Adventists, we've kind of lost track of our health message. At least I'm an outsider. I'm not, I'm new to this, okay? But we've kind of lost track, I think, of the health message that is from our very foundation of our church. And I think we need to get back to that as much as possible. Put people like me out of work. And with that, I close. I thank you very much. Okay, we'll bow our heads in prayer. Father in heaven, I thank you for the privilege of addressing this church. I ask your blessing on us. I pray in Jesus' name. Amen.